Morning, everyone. We're enjoying this wonderful weather. So suffice to say, we're very excited about getting into this conversation about the village movement and what it can offer the citizens of Talbot County. So I'm just going to get right into it. How many people have heard of Talbot Village Connections or the village movement? Great. Not quite. All right. So hopefully this will give you quite a bit of information. I think we're just gonna. I don't want to be in your way. So if I stand here, can everybody see? Okay, that's great. I don't want to sit. Excellent. All right. So what's a village? Village are nonprofit organizations, grassroots organizations that are developed to assist seniors who wish to remain in their homes for as long as possible. So the village concept is basically that each particular conglomerate of individuals, typically in close proximity to one another, are designed to help persons age in their community safely. They're typically governed by a board of directors, staffed by 1 volunteers and 1 to 2 paid staff, as well as the members are in the organization who participate in the governance of that organization. So basically the members drive the services and the activities based on that particular village in the community. So the village movement began at Beacon Hill Village in 2002. Now there's 205 villages operating in the U.S. and another 150 in development. So it's pretty exciting across the country. Obviously, persons are knowing that this particular movement is growing and going to continue. In Maryland, there's 15 existing or operating villages, as well as 7 in development. Kent County has home ports in Chestertown area, and the Queen Anne County has 1 in development. And then we in Talbot County have our village that's about to be off and running. Just to give you a little bit more background of the village movement, Beacon Hill Village helped to establish the nationwide organization called the Village to Village Network. And it's a network of organizations with over 300 member organizations, a part of the Village to Village Network. So it's basically a support system for all of the various villages that are either in development or already in existence to provide resources as well as support. So, what does it really take when we talk about the village concept? How many people in here, as they think of their aging years, are interested more in being in the community or not in the community, in a facility? Anybody? In the community, right? That would be 100%, right? Because typically we see, unfortunately, in institutionalized settings and environments, that you might not always get the best care, or at least the care that you would come to expect in your own home, because that's where we feel more comfortable, or most comfortable, I should say. So, however, with knowing that, and especially as a person who's done in-home care for several years, it takes a lot. It takes kind of a village to put all the supports in place to make sure that you're able to age in the community, in your own home, in a safe environment for yourself. So this particular slide talks about thriving in your own home in the community, which is exactly what all of us want. So it takes community engagement, the community supporting you. Assistive technology might be something such as a phone that has amplification, such as big buttons on the phone, anything assistive, something that's necessary as you age and may have issues related to technology in your home. Social supports are also necessary. Grocery delivery. How many times do we think about those small little things? It's easy to jump in your car and go to the grocery store and have everything you need. But what about grocery delivery? Wouldn't that be convenient if you're looking to thrive in your own home in the community? Prescription delivery, that's another need that we find especially in our rural community. In our rural community, the world is quite different than in some of the urban areas. Home modifications may be necessary. Some of the things that we take for granted, again, steps leading into our home, steps within the home. They may require ramps or some sort of assistance with home modifications to make sure that you have everything to keep you safe while you're in your home. Home maintenance assistance, something that you yourself or maybe your spouse or somebody living within your home may have been accustomed to doing for you. Something as simple as changing the light bulb, that may be higher than you would want to change. It might not be as safe for you as we age to step up on a step ladder within your home, especially if you're living by yourself. So that might be a concern. So home maintenance assistance is also a needed service. Reliable and affordable transportation. What would we do if we couldn't drive? And then, how would we be able to thrive in our own home, in the community, without that necessary connection with transportation? Resource referral. Sometimes working here at the Senior Center, I'm the information and assistance specialist. So we have quite a few resources that we can direct persons to in the referral sense to let them know, hey, these particular services are available in the community, or did you know about this? That kind of thing. Care coordination as well as comprehensive medical care. Those are in red there because those aren't services, those are medical related services. So although they're necessary for you to thrive in the community, we rely on the service professionals for those particular items, such as care coordination, because typically they need a skilled level of care for those. Okay. The village movement services. Typically, village services include, and this isn't just an exhaustive list by any stretch, this is just a snapshot of some of the services that other villages, including our own, will include. So those things, just as I mentioned, transportation, social and educational activities. We find that it's extremely important as you age in the community that you keep connected to the community so that you're not in isolation. You don't feel alone when going through different issues. So we will be bringing those particular activities to the table with the village that we're creating here in the county. So we need your help to do that also. Minor home repairs, again, just like I mentioned, the light bulb or perhaps the ramp that might need to be developed or established in your own home. Preferred provider list of vendors and services. Obviously, we know we can't do everything. That's why we would rely on vendors, for-profit and nonprofit vendors, a list of vendors and services to provide the stopgap, some of the services that we're not able to directly provide or refer to. Friendly visitor program, that's important. Obviously, we have persons in our community even now that don't see other people on a week-to-week basis. And so if persons are interested in having that level of service, then it's good to know that we have volunteers or members of our organization that would be able to stop by and just say hi. Maybe somebody just needs a little encouragement for the things that they might be going through. Light household and garden chores is also an item. Home organizational assistance. Frequently, we deal with seniors that are aging that are kind of all over the place. Papers everywhere, not necessarily sure what to throw out, what to keep. Where's my bank book? Those types of things that just happen just with aging. And so we want to be able to provide that kind of assistance as well because it's a needed service. And health and wellness programs. So again, this isn't an exhaustive list, but quite interestingly, the top service or one of the most popular needs within villages is transportation. So we know that that's an issue, especially in our rural community. Okay. The village movement. Why now? Now this is what we call the big picture. 77 million baby boomers, which is a third of the U.S. population, are in existence right now. That's a huge number when you think about it. Of which both my mother and father, which now are in this community, are baby boomers. I'm 44. So who's going to be taking care of both my mom and dad? Me. And so it's really important for the assistance within the community so that we can support one another. So we can say, you know what, I'm going here. Can you take Sally over here? Because everyone's working together, we find that it's a better type of atmosphere. 10,000 baby boomers are turning 65 every day for the next 14 years. That's pretty astounding. Pretty astounding. And that's the Pew Research Center. And obviously there's a rising demand for services and shrinking number of family caregivers. Within the community, we have several persons because Easton's a wonderful place. I was born and raised in Talbot County. As soon as I graduated, I hit the city. And then 18 years later, I migrated back so I could be around my mom and dad. They're 10 minutes from me now because I know that they're also going to need that support in the community. And so that's a rising demand and shrinking, and the shrinking number of family caregivers is a very real effect on people in the community. Because typically we have persons who move to this community who aren't from this community. And so we get calls all the time, you know, this daughter is in California and mom and dad are here, and who's going to take care of them? Well, maybe you want to think about, you know, helping an organization or having providers kind of help with the aging population in that regard. But also the demand. State services aren't going to be available for everyone. There's always persons that fall within the cracks. And so that's what we hope to do with the organization, is kind of fill in the cracks for agencies that are doing a whole lot more with a whole lot less. 90% of persons 65 and older who wish to remain in their homes and be independent as possible. We had 100% here in the room, didn't we? All of us. And also, why here? The number of older Marylanders is increasing. 2010, the number was 18.6% were over the age of 60 within the state. By 2030, it's projected to reach 25.8%. And that's in the entire state. But let's just even narrow it down to Talbot County. 2013's numbers were that there were 33.5% of persons over the age of 60. Now that number was bigger than the state, wasn't it? That's huge for our small little community. By 2030, it's projected to be 39.8% of persons over the age of 60. And in Maryland, over the age of 60, it's to be 25.8. So look where our number is in comparison to the state. Pretty large. So we obviously know we have a good problem in that this is a really wonderful community for everyone to come to and retire. But our concern is that there aren't going to be enough programs or services to support persons who want to live in the community. So we have to do the work now to put those pieces in place. Societal benefits of village organizations. So we talked a little bit about the programs that will be available within our membership-driven village, but they offer practical solutions to growing social issues. We keep seniors at home because it's a prudent public policy. It's not hard to say 3 times. We provide in-home care. Providing in-home care greatly reduces these costs by reducing the need for premature placement in nursing homes. You know, no one just wakes up and say, you know what, I think I'd be better off if I was in a nursing home. Typically, they want to be able to have supports within the home. And one of the greatest expenses associated with long-term care spending is that long-term care, assisted living, those kinds of services that aren't necessarily paid for by anyone else other than perhaps long-term care insurance, but that's only a portion of it. It's not going to pay for 100% of care. Other benefits, low-cost safety net. So it's kind of good to know that some of the services that we would be able to offer in our village, our membership-driven village, would take some of the burden off of you. Maybe not all, but it kind of gives you some peace of mind. And it reduces isolation, and it allows seniors, of course, to age in place as they wish. We also encourage the volunteerism, neighbor helping neighbor kind of concept. And we serve as a collective voice to encourage age-friendly communities, so within our own community. And coming soon is our nice new logo, Talbot Village Connections. And so I'll just turn it over to Marion from here.
Thank you.
Thank you.
Thank you very much, Pam.
You're welcome.
As you heard in my bio, I'm one of the come-heres, and I've only been here 2 years. I've been fortunate to get involved with Lee Newcomb and a few other people who were have really put together an exploratory committee to look at developing a village here in Easton. Well, actually not in Easton, in Talbot County. So just to give you a bit of information about how we got together, how we formed, this is really a timeline. Can you see? I'm just kind of standing in your way. This is really our timeline of how Talbot Village Connections came to be. So in October 2014, we became officially known as the Talbot Village Exploratory Committee. And that was a group of people, probably 10 or 11 of us, that got together. Most of us had heard about villages, read about villages, and thought that Talbot County would be a good place to develop a village. In January 2015, we became a member of the Village to Village Network, and that, as Pam said, is an organization that has helped us. It's given us a lot of resources and support, and they really, that organization represents over 300 villages, either in development or officially operating in the United States. In July of 2015, we formed the association with Midshore Community Foundation, and they are our fiscal sponsor, allowing us to be a not-for-profit organization. In the summer of 2015, we held informational sessions throughout the county. So in different areas, both in Easton, St. Michael's, Trapp, Cordova, we went out and invited people to come and listen to a presentation similar to what we have today, and to get their feedback, to see what they were, what they liked about it, what suggestions they had for us. We had a lot of interest from those informational sessions, and so it encouraged us to go forward. Then we received a startup donation from Shore Regional Health, a small donation, but really enough to kind of get us started with some beginning expenses that we had. And Shore Regional Health understood that this is an important step in supporting seniors. There's going to be, as Pam mentioned, not all county governments, federal governments are going to be taking care of all of us. We need other support systems. And this support system is really about volunteers, neighbors connecting with neighbors. In October 2015, we incorporated and informed our board of directors. We adopted our bylaws. And then in March 2016, we began to seek donations from private foundations and individuals and public entities. And then we began recruiting volunteers. We're doing that right now, recruiting volunteers, because we feel we have to have our volunteers in place before we actually get started. And we're planning to have a launch party, a beginning opening party, sometime in the late fall or in January. Our target date for opening is January 2017. This is our board of directors. I'm the president. Pam is the vice president. Pat Flory, she lives in Claiborne. She's our secretary. Lee Newcomb, who is here today, who is a social worker with the Department of Social Services. Lori Ramsey is from St. Michael's. She's an outreach worker at Christ Church in St. Michael's. Connie Loffer is here today. She's from St. Michael's. Chuck Callahan from the County Council. Terry Ross is the Regional Director of Care Coordination at Shore Health. Frida Wadley is a physician. She's the Talbot County Health Officer. And then Lee Gordon is our attorney advisor, and she's an attorney that specializes in elder law. So we have a good group of people who are working hard to make this a reality. It is a membership organization, so people are asked to join and pay dues. The membership will be open to 55 and older. And the idea between having 55 and older is we hope that these younger group, the 55 people and the 60-year-olds, will be able to work as volunteers and really support the organization in thinking about the future, because they know that at one time they will begin to need services. We're finalizing our dues at our October board meeting, and what we're looking at is $20 a month for a household membership, 1 to 2 members, $15 for a single membership, $15 a month. We also will be raising funds so that we can have supported, or what we call scholarship memberships, because we recognize that not everybody will be able to afford even the $20 a month, the $15 a month. We want to be open to all, because we really believe that this is a very needed service. So our initial services, beginning in January, friendly visitor. We have a number of volunteers that we've recently recruited. Part of the volunteer process is we will background check all our volunteers and train all our volunteers. Some of our volunteers will be doing transportation, others will be going into people's homes. So we want to make sure that we've done sufficient training and background checking. So we'll have a friendly visitor program, a telephone reassurance program. That's not for everyone, but for those seniors maybe who are alone and homebound, they may like to have a phone call every day. Just somebody to check in, see how you're doing, do you need anything? Just somebody kind of reaching out to them. Because as Pam mentioned, some people are very alone, more so than we even realize. And then transportation, as we mentioned, that's always comes up as number one and what people are looking for, because we know that as we age, sooner or later we have to give up driving. And that's a sad day when that happens. But if you have something in place, if you know you can call upon this service, as opposed to calling your daughter, who may live nearby, but who may not live nearby, or relying on your neighbors that you've relied on over and over again. Maybe you feel a little bit guilty about calling them again. If you're a member of this organization, you pick up the phone, you call the coordinator arranges the transportation part. The monthly lunch and learn, as we really believe that this program, and aside from these services, a very important component of it is the educational and the social opportunities for the members. That's for the members to come together, get to know each other, get to know us, whoever is running the program. We will eventually have staff people. Right now it's the volunteers, it's the board members who are running the program. But we will eventually have a coordinator, have an executive director, and it's important for our members to get to know those people face to face, but also get to know each other. And so it might be a social outlet for some people who are feeling a little bit isolated. So we'll have a monthly lunch and learn, and then other educational opportunities as we go along. I think we have a lot of partners that we're working with who will be able to provide us with some good programs. Beginning, we don't want to overpromise in the beginning. So January, February, March, we feel like we can at least manage that. And then beginning in April, we will definitely have our preferred provider list. And what that is a list of people, service providers, and it could be ranged from anywhere from an electrician to a housekeeper, anything you can think of. People that we have vetted. And by vetting, I mean we will check their references, check their business license, make sure that they're a bona fide provider of services and have a good reputation, so that before we recommend those people to you. So if you're a member of the organization, you can call up and say, I need a plumber. We give you the names of 2 or 3 plumbers that have become recommended on our list. Minor home repairs, and we have a lot of volunteers, a lot of people who are interested in volunteering that can do minor home repairs. And as Pam mentioned, changing those light bulbs, changing the filters on your HVAC operating system. Those things don't seem like a big deal when you're 50 years old, but when you get to be 75, 80 years old, it becomes a different story. So sometimes people just need a little help like that. Technology assistance is something that people are very interested in. And I mean, who among us hasn't bought a TV and then had to struggle through getting that thing operating? Your iPad, your laptop, these are things we all have in our homes now. And yet it's not that easy to get them up and running. So we hope to have a very active technology assistance. In fact, I spoke to a gentleman yesterday who's signing up to be a volunteer for us, and he was really excited to do this because he said it's been a love of his. It's not been a field he was in. He's actually a retired physician. But he loves to do this, and he said, I just can't wait to get started. So we hope to have a few of those people who will help us get going. As I mentioned, we'll have an executive director and probably a volunteer coordinator. That we'll probably start with a volunteer coordinator. Hopefully that person then turns into a full-time executive director. Right now, board members are really filling these roles. Villages do depend on volunteers because the dues do not support the organization. The organization is really supported by its volunteers, maybe some fundraising donations from others, but we really will be depending on our volunteers. And as I mentioned, we'll do a background check, screening on the volunteers, and then training them for specific duties, for developing a volunteer handbook and specific training. So you might have training for transportation, or you might have training as a friendly visitor or a telephone reassurance person. All those things we are developing training programs for. We want to make sure that our volunteers feel comfortable whatever they're doing, that they feel like they've been trained, they have the background, they have the backup to call somebody when they're out there with our members. And then villages partner with other organizations. We have done so already, but the list of things here is kind of what you might expect: the Department of Public Health, Shore Regional Health System, the Department of Social Services, the Senior Center, senior living facilities, senior providers, faith-based organizations, and other local businesses. Those will all become, if they have not already, will become partners with us. Because as we know, it does take a village to get this going. We are, this is an example today, but we're having membership meetings, volunteer recruitment meetings, kind of getting the word out now. As in our first wave of going out and talking with people, we were just sort of developing the concepts and everything. Now we're ready to go. So when we go out and talk with people now, we say, if you'd like to sign up and be a volunteer, if you'd like to hear more about membership, we're very eager to get together with you one-on-one and talk about membership so that you can learn more about it. You can sign up to be on our email list, and we'll probably have a big announcement in the paper as we get closer to our January opening. This is a little more information about, I have some handouts here. If you'd like to learn more about villages, there's actually a lot. If you Google villages, Village to Village Network, there's quite a few articles that have been written, and there's a lot of YouTube videos. We have a couple here today, if you're interested. Let me just, I'll pause and take a few questions or comments, and then we can look at a really interesting video, which I think kind of basically describes what we've been talking about today. Any questions, comments? Gary.
Sounds fantastic. I think it's certainly needed in the community.
I know you've heard about it from the Talbot Commission on Aging, but you haven't really probably heard in depth about it. Sounds like something that might be needed? Yeah.
Definitely, all of the services are key to keeping people in the community. So
yes, they are. Thank you. Anybody else? Yes.
And Beacon Hill, I believe, is an actual community.
Yes, let me talk about that. Beacon Hill, I come from Boston, so Beacon Hill started in Boston. That was the first village. And that was a group of people who got together in the Beacon Hill neighborhood, which is a rather la-di-da neighborhood. But they recognized, I mean, these are townhomes for the most part, three or four story townhomes. And they recognized that as they were getting older, that they were going to need some help in order to stay there. And in fact, there's kind of a funny story of a couple who were out on their roof trying to shovel snow, and they said to each other, we cannot continue doing this. We need some help. And so the neighbors got together and began this village. And from there it took off. They have over 600 members now. And a very active village. They own their own building, and they have recreational and educational opportunities. It's a very active village. And so they became the model. But you know, when we talk to other villages, no two villages are alike. It really depends on where it's located, the members themselves. The members participate in the formation of the village, really. And as we look at Talbot County, it's a large county, so we will have villages here and there that will just all report up to one board of directors. But you know, we will most likely have different villages in different communities, so that we can draw upon those volunteers from that area to support those people living in those neighborhoods.